on this
Yes.
work on the agenda. So that's the last. Let's do that one first. The last shall be first and the first shall be last. House Bill 933, nursing homes direct care wages and benefits and cost reports. Delegate Martinez. I understand there is an amendment which makes it a study. Is that correct?
Yes. With the amendment, the Maryland Department of Health will be required to review cost reports and data submitted by nursing homes that participate in Medicaid, including data related to revenues allocated to specified professions, and report its findings each year by October 1st through 2029.
Okay. Is there any discussion? Is there a motion on is there an amendment prepared?
Yes, that was the amendment I just
Okay,
discussed.
I'm sorry. Okay, is there a motion on the amendment?
Move the amendment.
So moved. Is it seconded?
Second.
Moved and seconded. All those in favor?
There is one other
Lynn.
change that needs to be, I think, made to the amendment that Mr. Lucci was going to.
Okay, Len, go ahead. Unmute yourself, please.
Sorry, I'm so rarely muted.
You're new here. Yeah.
Thanks. The discussion among the stakeholders was be that all existing language would be deleted from the current bill and substitute this language be substitute for that. And I think the amendment would need to reflect that, as well as we're going to add two more categories, job categories. We're going to list the different job classifications. We're going to add housekeeping workers and dietary workers, and then that would reflect the agreement among the stakeholders on this bill.
Is that your understanding, council?
That's my understanding.
Okay, so the amendment will reflect that.
Great.
Correct.
Okay. Okay, fine. All those in favor of the amendment say aye. You're all muted.
Aye.
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 Anyone opposed to the amendment? Is there a motion on the bill as amended? Is there a motion on the bill as amended?
Move the bill as amended.
Second.
Okay, moved and seconded. Is there any debate?
There is Christina Moore has her hand raised.
Okay, thank you, Council. Ms. Moore. Motion on the bill as amended.
Move the bill as amended.
Second.
Okay, but Ms. Moore wishes to speak.
Good afternoon. Just on behalf of Maryland Legal Aid, we're concerned that the bill is substantially changed from its initial form. Currently, as a study, there's no meaningful process to again address the continued concerns of private equity entering this particular realm of healthcare, of skilled nursing facilities, increasingly prioritizing profit over patient care. We've repeatedly articulated our desire for the legislature to authorize the Maryland Department of Health to promulgate regulations regarding the information that they're going to receive. It's unclear why the Maryland Department of Health does not want to be involved in the regulatory process, wants to collect data and submit it back to the legislature, but it would be a compromise. It would be something that we would support for the legislator to authorize the department to promulgate regulations based on the data that they receive to effectuate a percentage of revenue as defined by the department with regard to direct care and staff wages. So we're just concerned that the bill in its amended form requires the department to collect information and give it back to the legislature. We think the department can do more and should do more.
Is there any discussion? Mr. Lucci?
Ms. Moore conveys a valid concern, but that's not what this bill was for. I mean, we do think it's a valid concern, and last year, Senator Bidel successfully sponsored a bill that would require more disclosure by nursing homes and their cost reports with regard to private equity ownership. So we think that's a concern, but we don't think this is the bill to address that. And there was one last year but that was the first step on that.
And that bill passed?
Yes,
And what impact has it had?
it's just getting started now, but it's really the Maryland Healthcare Commission that's supposed to be doing more scrutiny on disclosure of ownership of private equity owned nursing homes.
I believe they've
with
issued an interim report and have a final report due soon.
With all due respect, that bill is with regard to like the purchasing and acquisition of nursing homes, but directly related to that, the residents and the clients that we have in nursing homes have very legitimate, concerns about their care. And we believe some of that is attributed to nursing facilities, again, prioritizing profit over care. This bill does, in its original form, does require and set a percentage of revenue that would go towards staffing. It didn't address how the cost of care factored into that, and that was a part of Maryland Legal Aid's testimony. But in its amended form, we don't believe that collecting data and submitting it back to the legislature is necessary. The department's going to obtain data and is very much able to, based on the data they receive from skilled nursing facilities, based on information that they have with the Office of Healthcare Quality, they're best positioned to make a recommendation about a percentage of revenue skilled nursing facilities should be directing toward care and staffing. And it's our continued recommendation that the bill direct the department to make that recommendation through the regulatory process. I appreciate you allowing me to be heard on that.
Is it acceptable to everyone, not necessarily to dictate the result, but to have that issue considered as part of the study and the numbers gathering?
There are a couple of others that have their hands raised, Jamie Smith and Dana Kaufman. I know Dana was part of the group that's already, talked about this and come to this consensus of having the study, but you might want to call on them to see what they.
Okay, Dana?
Thank you. So we are comfortable with the study. The idea was to take a look, gather the information, and then from the information that is gathered, it's almost like a two-parter. We're not comfortable with just going ahead on the second part. We'll support the bill as it has been accepted and amended by the committee, but we think we need to have a data discussion first before telling the department to do regulations.
Jamie Smith?
Yeah, thank you so much. Jamie Smith from the Maryland Department of Health, and we agree with the bill as amended. We think this is a very strong first step in collecting the data. And obviously we want to make sure that we have time to review that data before any enforcement action would be taken. So we do agree with the bill as amended.
Okay, so the motion before us is the bill as amended by the amendments that would change this to a study. And certainly the legal aid is able to participate in that process. All those in favor of the bill as amended, please say aye.
Aye.
Aye. Is anyone opposed to the bill as amended? Okay, the bill moves forward as amended. That's House Bill 19. Lisa, I understand you have one more bill, House Bill 933.
That was the bill we just did, House Bill 933.
Oh, I apologize. All right, so then we're back to the top of the list, House Bill 19. Health occupations, nursing, loan repayment, education, and sunset extension. Building Opportunities for Nurses Act of 2025. Council?
excuse me, this is an MDH departmental bill that extends the termination date for the State Board of Nursing by 5 years to July 1st, 2030. The Secretary of Health continues to have authority over the board's infrastructure operations. The bill, as originally introduced, removed nursing support staff as eligible participants in the Maryland Loan Assistance Repayment Program for nurses and nursing support staff, and expands eligibility to additional nurses. The bill alters education requirements for licensure, adds an exception for licensure by endorsement, and repeals provisions regarding nursing assistant training programs. The termination dates for the nurse preceptorship income tax credit programs are extended also to June 30th, 2030. I circulated some amendments moments ago from MDH that were an update to amendments that I'd circulated previously. The amendments from MDH re-include nursing support staff in the MLARP for nurses and nursing support staff, lower the rotation hour requirement from 100 hours to 90 hours. This is an amendment that was also supported by the Maryland Community Health System, Maryland Association of Nurse Anesthetists, and Maryland Nurses Association. It also incorporates an amendment from the Maryland Association of Community Colleges to add an associate or baccalaureate degree as far as their requirements for registered nurses. And then also extends the effective date of a certified nursing assistant bill from last year by 1 year. The other thing that I circulated on this bill is the bill has a high fiscal note, the transfer of infrastructure operations to MDH from the Board of Nursing. Previously, when we did this 2 years ago, when you all did this 2 years ago, it transferred those costs from the Board of Nursing Special Fund to the general fund. So the fiscal note anticipated about $5 million for that if this were to continue. So the Department of Health is pursuing an amendment to the BRFA that would allow them to use the Board of Nursing special funds for those infrastructure operation costs. So those are costs that would normally, if MDH didn't have operational control of the board, would be borne by that special fund anyway. And then I'll note also that this bill, after that change, still has about a $200,000 fiscal note for the extension of the tax credits.
Is there discussion on the amendment? Does anyone wish to offer the amendment? Delegate Cullison.
Thank you, Mr. Chair. Yeah, thank you, Mr. Chair. I have a question relative to the fiscal note. Has this bill gone through the process for looking at for examining fiscal notes this year?
It is in progress now, but the full committee would not vote on it until we get that approval back.
Okay, all right, thank you. Then I will move the amendments then.
Second.
The amendments are moved and seconded. Is there debate on the bill as it would be amended? With the understanding that the full committee would not vote on this bill as long as it would still have a fiscal note of this size unless authorized through the process they were through appropriations. Okay, all those in favor of the amendment, bill, adding the amendment to the bill, please say aye.
Aye.
All those opposed? Okay, the bill is unanimously amended. Is there a motion in support of the bill as amended?
Move the bill as
Second.
Moved and seconded. All those opposed, all those in favor, say aye.
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 Anyone opposed? Okay, Delegate Riley is opposed. Okay, all those in favor of the bill as amended, please say aye. With
Aye.
the caveat, the
Aye.
understanding that it will not move forward to the full committee until we hear back regarding the fiscal note. All those in favor say aye.
Aye.
Is anyone opposed? Delegate Riley. Okay. That House Bill 19 moves forward as amended. House Bill 573, State Board of Dental Examiners, expanded function dental assistants education and reinstatement, Delegate Kipke. There is a sponsor amendment, I understand.
Yes.
Okay.
As introduced, this bill requires the State Board of Dental Examiners to reinstate an expanded function dental assistant certificate that is expired only if the holder has completed the continuing education requirements set by the board, has submitted a renewal application to the board before the deadline set by the board, and pays a renewal fee set by the board. The bill expands the authorized courses of study an applicant may complete to qualify for certification. The board must adopt regulations requiring continuing education to include an option for an online course of study and be offered by, as originally introduced, dental professional societies affiliated with national dental organizations and specified entities, and a course of study for initial certification must include, when appropriate, an option for an online course of study. The sponsor has offered amendments that were circulated that specify that the course for initial certification of an expanded function dental assistant
Yes.
must include, rather than an option for an online course of study, at least 35 hours of instruction consisting of both online and in-person instruction. Requires the board to adopt regulations specifying the required number of hours for in-person instruction, online instruction, and clinical hands-on training. Removes from the bill the requirement that board regulations on continuing education for expanded function dental assistants include an option for an online course of study, and requires the regulations to specify clinical hands-on training and be offered by state-based dental professional societies.
Is there discussion on the amendment? Chair seeing none, we'll take a vote then on the bill as amended. On the adoption of the amendment, excuse me. All those in favor of the adoption of the amendment, say aye.
Aye.
Anyone opposed to the adoption of the amendment? There is no opposition. Is there a motion on the bill as amended?
Move the bill as amended.
So moved. Seconded. Is there a second?
Second.
Seconded. All those in favor of the bill as amended, say aye. Or raise your hand.
Aye.
Okay.
Aye.
Is there anyone in opposition to the bill as amended? Delegate Riley, you are not in opposition. Okay. It is unanimous. The bill moves forward. House Bill 602. State Board of Nursing, Advanced Practice Nursing Licensure and Specialty Certification Reciprocity Discussions.
This bill requires the Board of Nursing to hold discussions with the state nursing licensing boards for Delaware, Pennsylvania, Virginia, West Virginia, and the District of Columbia to pursue reciprocity agreements for advanced practice nursing licensure and specialty certification by November 1st, 2025, and each November 1st thereafter for the next 4 years. The board must submit a report regarding those discussions to specified committees of the General Assembly.
And there are no amendments to the bill.
No.
Is there discussion?
Move the bill.
Bill is moved. Is there a
Second.
second? There is a second. Is there discussion on the bill? Okay, all those in favor of the bill say aye.
Aye.
Is anyone opposed to the bill? It is unanimous. Well done, Delegate Hutchinson. House Bill 664, Health Occupations Licensed Direct Entry Midwives, Disciplinary Actions. Delegate Tarasa.
This bill clarifies the actions that the Board of Nursing may take if an applicant to practice direct entry midwifery or a licensed direct entry midwife violates a ground for discipline. The board may deny or grant a license, including a license subject to a reprimand, probation, or suspension to any applicant, reprimand any licensee place the licensee on probation, or suspend or revoke the license of a licensee. There are no amendments on this.
Is there a motion? Caitlin McDonough.
Yeah, I just wanted to know, and I apologize, I meant to do this in the hearing, but I screwed up my signups. This law is set to sunset on July 1st. So I don't think there's any issues from the midwife community with the provisions in this bill, but to pass this bill without a sunset extension that is in some of the other bills on the agenda today, will have no effect, like it will sunset. So I just wanted to kind of clarify that, just like a kind of a procedural point for the committee. But I know there's other bills dealing with that, but just how the two bills might interact to each other, I just wanted to point out.
There's
Would
a
you like me to
sunset-
address that?
Yes, council.
So all of the health occupations have sunset provisions on them, and the sunset provision, you're right, it's extended in House Bill 19. But the rest of the bills go into effect with the assumption that those sunset. But you're correct. If we were to not extend the Board of Nursing and all regulation of nurses and the other practitioners that are regulated by the Board of Nursing, then it
Well,
would.
this specific health occupation sunsets. And so if you don't add a sunset to this bill and don't pass the other bill, this bill would have no effect.
Right, but the assumption is that the General Assembly will continue the Board of Nursing and the regulation of the practitioners that are under the Board of Nursing.
But I think there's a LDM specific sunset in law.
There's a sunset for all of the practitioners, like all of the.
So if this bill were to pass and no sunset were to pass, like, I mean, I'm not talking about but there is no bill pending before the General Assembly to expand the sunset if unless the other bill, you know what I'm trying to understand what would happen if this bill just were to pass alone.
I'm sorry, I
With
guess
the-
I don't follow the Board of Nursing bill, I believe, covers all of the practitioners that are regulated by the Board of Nursing in
There's another separate Board of Nursing bill.
the House Bill 19 that we just did.
Okay, all right. I apologize. That's my confusion.
So you're withdrawing your concern?
Yeah, I mean, it was not to occur. I would advocate for the other bill that has a sunset extension in it as well. But yes, I'll withdraw. I'm sorry, Mr. Chair.
No need to be sorry. Okay. All those in favor of this bill? With,
Aye.
say aye.
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 Anyone opposed? It is unanimous. Okay. Next bill is 664, health occupations, licensed direct entry midwives, disciplinary actions. Lindsay? There are no amendments, it's my understanding.
Right, and I apologize, I was just grabbing my House Bill 19. So the provision in that bill, I think it's on page 12, the extension of 86C 26 to 2030 is in House Bill 19, just to make sure that everyone's on board with sort of where that's covered. But Caitlin's right. You guys, the General Assembly has to make sure that the Board of Nursing gets extended and all of the various professions right there. Sorry, 723. This bill requires the State Board of Dental Examiners to issue a license to a dentist or dental hygienist licensed in another state within 15 business days after receiving the
Are we
application.
on 723 or 664? Or have we already?
Oh,
done
I'm
it?
so sorry. I thought we finished 664.
We have finished 664?
Yes. Yes, we
Okay.
finished it.
Fine, I apologize. House Bill 723, State Board of Dental Examiners applicants licensed or certified in another state.
Right.
Lindsay?
House Bill 723 requires the State Board of Dental Examiners to issue a license to a dentist or dental hygienist licensed in another state within 15 business days after receiving the applicant's completed application, if the applicant otherwise meets the requirements for licensure. The bill also specifies the requirements a dental radiation technologist authorized to practice in another state must meet to qualify for a certificate from the board. If an applicant for a dental radiation technologist certificate authorized to practice in another state meets the requirements for certification, then the board must issue the certificate within 15 days after receiving the completed application. The board may adopt regulations necessary to provide for the certification of individuals authorized to practice as a dental radiation technologist in another state. And there are no amendments on this one.
Is there any discussion on this bill?
Move the bill.
Second.
So moved. Second, Delegate Riley.
Sorry,
Wish to
Mr.
speak?
Chair. So,
Sure, go ahead.
yeah, so I had on there, some of the opposition was concerned about the 15 days, if that was reasonable, if that needed to be lengthened any to have that, has that been discussed?
Council or
Mr.
one of the
Chairman.
parties? Yes, Mr. Doherty.
Yes, in both the hearings in the House and the Senate, well, a hearing in the Senate, there was no testimony in the House. They indicated that the board currently does this within 10 days. But that's by their own policy. It's not required. This bill gives them 15 business days, which is longer, but it does provide in statute a requirement they do it within a specific period of time, which allows people who are needing to fill spots in their dental practice, getting people licensed or certified from out of state more quickly. So I'm not aware of any discussion to it that was not long enough. There was a discussion they do it in less time. And we're going to put in statute a bit more time to give them flex time, if you will.
Okay, so there is agreement to move forward with the bill. Is that correct, Dan?
Well, that was the only issue on that was raised by the board in the Senate was we don't think we need it because we do it anyway. Our response is things change, executive directors change, members of boards change, and we want to make sure the statute is there to make it clear successors have to follow a time frame of 15 business days to either reject or issue a license when they have a fully completed application before them.
It's similar to the
So in
previous.
answer to your question, no, they didn't agree to putting it in statute, but they did agree they do it in less time than that.
Okay. So the bill before us is unamended, and there's a motion to move forward. All those in favor say aye.
Aye.
Anyone opposed? It is unanimous. Okay, I believe we're going to hold House Bill 838 as there's still some amendments being drafted. The sponsor amendment,
Yes, Mr. Chair, if I may.
please.
I appreciate the time and the agreement to hold. I will say that MHA and the advocates and the midwives have worked out a set of amendments which have been presented to the Board of Nursing. I need some time to understand the Board of Nursing's objections to many of the amendments that have been worked out. So I'm in the process of scheduling a meeting on Monday. We were supposed to meet on Wednesday, but we all know what Wednesday turned into. So we're going to try to meet on Monday and see if we can't resolve these issues finally. So I appreciate the time that the committee is giving us.
Okay. So no action on this bill at this time.
No, please.
Okay, and we've done 933. I don't want to do it a third time. Make a total fool of myself. Okay, we are done. By my calendar, we have 33 minutes until the full committee. And I thank all of you for your time and effort. We are adjourned. Thank you.